So I'm Robert Baptista, and today I will be walking you through some of the aspects of your circulatory system. We're going to start with the anatomy of the heart. So I've already drawn the heart, and we'll start with the atria and ventricles, which are the big chambers in your heart. So this one here would be your right atrium, your right ventricle, your left atrium, and your left ventricle. So it seems like they're labeled backwards, but it's because if you were looking at a person with this heart in their chest, this would be on their left side. That's what we call anatomic position, labeling anatomically. So these couple of gaps here are your valves. This one here is your tricuspid valve. This is your pulmonary valve. Wow. Having trouble with that spelling today. This would be your aortic valve. And your mitral valve. Blood flows through these valves, and they are all single direction. So once the blood goes through, it can't back out of it. This large chunk here, this is it's called the septum, the interventricular septum. We'll just label it as the septum. It separates the right from the left. And this down here, as you might notice, this is a bit wider than it is on this side. It's because your left ventricle is responsible for pumping blood all the way through your entire body, where the right ventricle only has to push it to the lungs. So this one needs to be a fair bit stronger. So now that you have an idea of the basic anatomy of the heart, we'll kind of explain the electrical system. So it all starts up with the SA node, or sinoatrial node, up here, which fires. It's called the pacemaker of the heart, and when it fires, it causes a charge of electricity to come down to about here, which we're going to call the AV node. Atrioventricular node, since it's kind of straddling the atria and a ventricle. And when it does that, it comes across these little pathways here, which are I don't have it written on my notes, but they're the internodal pathways. And then to get all the way over to this other atrium, it follows a path kind of over here. And that one's got a fancy name. It's actually the Bachmann's bundle. From the AV node, it's going to follow kind of a thicker electrical system. Sort of draw that in as we go. Over to this portion here, where there's another little grouping, and that part is your bundle of His. From the bundle, it's going to go down the bundle branches, which are also labeled anatomically, so I'm sure you can guess. This one here would be your left bundle branch, leaving the other side to be, of course, your right bundle branch. As it flows down that path, it's going to eventually get to a bunch of these little tiny offshoots from your bundle branches that are going to run on both sides. And those actually surround your ventricles entirely and just get smaller and smaller as they go. And those are all referred to, all of them collectively are referred to as your Purkinje fibers. So that's kind of the basis of your electrical system of your heart, which allows the mechanical system of your heart to function. So as these fire, they cause the myocardial cells or your heart cells to contract. As they contract in sequence, they cause your blood to flow. So if we're looking at blood flow starting up in this area here, I'm changing to a blue pen to show our blood that doesn't or is low in oxygen. It's not entirely depleted, but it's lower. So if it starts in your atrium, blood's going to flow down from your right atrium into your right ventricle. From your right ventricle, it's going to be pumped pretty forcefully up through your pulmonary valve. And from your pulmonary valve, it's going to flow up, on our drawing, I'm saying up based on how we've drawn it today, to your lungs, where it's going to become a part of what we refer to as pulmonary circulation. Once it hits the lungs, it's going to go through eventually a capillary bed, which is what I've drawn down here. This is a capillary. And capillaries are where your blood actually exchanges oxygen. So it's going to go from the blue side, deoxygenated, to gathering oxygen in the lungs and becoming reoxygenated. So now it's going to be red. So from your lungs, it's going to come back down into your left atrium. And to do that, it's following a pulmonary vein. Veins always flow toward your heart, arteries always flow away. So even though it's deoxygenated coming out of the right ventricle, it's actually flowing through an artery. Once it gets into your left atrium, it's going to pass through the mitral valve into your left ventricle, and from the left ventricle, it's going to go out your aortic valve into the biggest vessel in your body, well, the biggest artery in your body, I should say, your aorta, which will flow up and out and all the way down to the entire rest of your body, which we refer to as systemic circulation. In systemic circulation, it's going to fuel the entire rest of your body. It's going to start, like I was saying, as it's passing, it's going from your aorta. And from the aorta, it's going to branch off and eventually join some arteries. From those arteries, they'll become even smaller as they branch further, become arterioles. Arterioles, there we go. And then hit that capillary bed, which I realize I've spelled incorrectly. From the capillary network, it's going to start coming back, and it's going to come all the way back up until it eventually gets back into that right atrium. As it's doing that, it's going to flow through, similarly named actually, so you'll have venules, the smallest bits after the capillary, and then eventually those will join larger routes, which will be veins, until eventually they get up even higher and join your vena cava. The vena cava has two portions. It's got the inferior vena cava and the superior vena cava. The inferior is everything from about your heart down, and the superior is everything from the heart up. So that's how the blood flows, which kind of accounts for the entire mechanical system of your heart. Now, the way that the nervous system affects all of this is actually pretty simple. So your nervous system has two components. It has the sympathetic and the parasympathetic portions. Your sympathetic nervous system is what's in charge of your fight or flight response. So that can actually increase your heart rate. So sympathetic would increase the heart rate, while your parasympathetic nervous system is kind of your, it's opposite of your sympathetic, so it's going to constantly be trying to decrease your heart rate. So that's your parasympathetic. And the parasympathetic can actually be stimulated manually. It's kind of neat. If you stimulate your vagus nerve, which is a big part of your parasympathetic nervous system, you can actually force your own heart rate to slow down. You can do this by bearing down, like if you were trying to have a difficult bowel movement, that would cause your parasympathetic nerve to fire continuously and can actually cause you to pass out by overstimulation. So at any rate, that's kind of our walkthrough of the heart. Hope you enjoyed it. Again, this was Robert Baptista explaining the basics of your circulatory system. Thank you very much.